I'm General Fran Yvonne, the Adjutant General of the State of Connecticut and also the Commissioner of the Military Department. First and foremost, our thoughts and prayers go out to all of the loved ones who are suffering through this pandemic, those affected by COVID, and on behalf of the entire state and with the Governor's guidance, we really, our hearts and prayers, thoughts and prayers go out with them. We have three priorities. The first is the health and safety of our fellow nutmeggers, the citizens of Connecticut, and our National Guard members. The second is we ensure that we're ready, mission ready when the Governor calls. And the third is we are supporting our state and federal partners as part of Connecticut's home team. What you see here today, you'll see and you'll be able to tour later, is a federal medical station, 200 beds that we've surged, and Dr. Choi will explain later the specifics, but we had surge capacity to give some relief to the hospitals for those COVID patients. This is our main effort. Our main effort is to build medical surge capacity, again, to give hospitals flexibility. We, as you see on our board over here today, that's our current operating picture. Those are current operations today. There's about a dozen different operations, over 250 soldiers, airmen, militia members. The Governor's Foot and Horse Guard are also fully engaged in this operation. And like I said, our high water mark today is 250 soldiers, airmen, and militia members. And with that, I'm going to turn it over to Dr. Choi.
Good afternoon, everyone. My name is Dr. Stephen Choi. I'm the Chief Quality Officer for Yale School of Medicine and Yale New Haven Health System. This is a very different time than just a few weeks ago when the Governor and our team were reporting on the first reported case in Connecticut down at Bridgeport Hospital. As many of you know, COVID has descended upon the entire state of Connecticut. So what you see here is an incredible effort on behalf of our National Guard, Southern Connecticut State University, the Governor and his office, to do what we need to do to prepare ourselves, our hospitals, and our residents for a potential surge that may overwhelm the hospital capacity. While we have enough capacity at most of our hospitals today, that may be very different in a couple weeks. We are predicting that the worst weeks are ahead of us in the upcoming month of April. So this field hospital allows us to transfer recovered COVID patients out of our hospital who can then recover here with the help of other healthcare workers in a space that will allow us to take care of close to 200 patients that no longer need acute hospital care. So patients who do require some oxygen, IV fluids, assistance with food, can come here, be placed safely away from other household members who may potentially get transmitted with COVID. Right now, we have over 3,000 patients and residents across the state of Connecticut who've been diagnosed. We're anticipating that that number will drastically increase over the next few weeks. So this field hospital is absolutely critical to our mission for taking care of all patients that come to our hospitals in the state. Thank you.
Well, thank you, Dr. Choi. And my friend Jay Moran is the athletic director here, and he's proud that right now, where he used to play basketball, we'll be able to take care of over 200 folks recovering from the COVID infection. General Yvonne, I got to tell you, I've never been so impressed. Every time I see the Guard, I'm so impressed. General just told me that this is the same group that has spent 2 tours of duty in Afghanistan. And they got this set up in less than 5 hours. And some months down the road, they'll be doing another tour of duty fighting for America. I cannot thank each and every one of you enough, how much you get done in that period of time. What we're doing here, as Dr. Choi explained, is continuing to do what we can within our control to expand the capacity of our medical facilities. This Moorfield House is going to be a big extension. We're doing the same thing at Tully down in Stamford, going to be doing the same thing at Central Connecticut. We're looking at other facilities, and I really want to thank the Army Corps of Engineers and FEMA for helping to prioritize Connecticut as we get ready We have a little bit of time to get ready, and it will make a world of difference. I'll tell you a little backup on where we are. We've had probably another 429 infections, I think 16 fatalities. What that means is the trend continues pretty much along the lines of what we have been planning for. And in terms of capacity, in terms of people, I think our team is working well. I was on the phone for an hour with the Unified Command, which is all of our different commissioners and departments, private and public sector, and they're hanging tough. But it is getting tough and getting stretched. And just the number of infections within our core first responders. And this is not just nurses and doctors, but it's folks who work in the nursing homes. It's folks in corrections. We've had several now infections there. In our courthouses, we have to close down some courthouses. In our group homes for folks with disabilities, our homeless shelters. Fortunately, we do have some additional capacity in most of these places. Certainly in corrections, we're at the lowest level of folks incarcerated. We have wings that we can segregate people out and have them there quarantined on a safe basis. We have a number of nursing homes that have been opened up over the years, so we're going to make those more devoted for folks who are related to COVID as well. And that's how we're able to expand our capacity as we see fit. I'm not going to complain about the protective gear because that's obviously the one thing that we don't control where we are most at risk. And don't believe anything you hear about TV where they say they got plenty of protective gear. I was just on the phone with all the governors. They're all desperate for making sure that our folks, our first responders, are going into battle with the protective gear that they deserve. The gear was promised last week, and then they rescheduled for this week. And it's promised this week. And right now, we have very good authority that will be here next week. And we need it because we don't have the capacity to protect all the people we need to, which is not just nurses and doctors, but a lot of the front-line responders that I just mentioned to you. Testing, we're doing better. And our testing continues to ramp up. We have another major facility right here in the state of Connecticut. We're going to be able to announce very soon that they'll be able to do an additional 1,000 tests a day. That allows us to test more of the folks, maybe at a Yale New Haven hospital, see whether they're COVID, see whether they're not, see whether they need an ICU room or something else. It gives us a lot of flexibility, and it's part of the triage that we need that allows us to open up capacity where we need it. Well, we've had some conversations with the company that has got the 15-minute test and urging them to make sure that Connecticut is a priority. And what a 15-minute test would mean in terms of that person who maybe has flu-like symptoms or may have COVID, give them confidence that we're getting them into the right unit. And more importantly, or just as importantly, when it comes to all those other first responders, give them a little bit more confidence if we can roll out this test that they're safe and that the people they're taking care of are safe, knowing that they're there. You saw the briefing by the task force, the Vice President's task force. You saw the big swoop of, depending on how bad things get, it could be 100,000. It could be a lot more than that. And the one thing that struck me as I looked at flattening the curve or how steep that curve could be, two things struck me. One, all the stuff about the General Motors and the auto companies and making ventilators and the scheduled delivery date in 2 months, that's all on the backside of the curve. That's not in time to save lives. So we're working everything we can to save lives right here and now. The other thing that struck me on a positive note was that I used to say, social distancing makes a difference. Look what they did in Singapore. Look what they did in Hong Kong. Look at how they were able to save lives by very strict social distancing. And people wondered whether we'd be able to do that in the United States, just given our culture of freedom and democracy. But while sadly you see the rate of increase in New York City going up and the social distancing not having as much of an impact there, you see places like Washington State and Seattle, Washington, American democracy, where we are able to social distance if we take that very seriously. And you can definitely flatten the curve and make sure that the ventilators are here in time to save more lives. And that's what we got to emphasize every day. I just did another one of the executive orders. This one we just reminded people at grocery stores that we're not going to allow more than 50% of capacities. So if your grocery store has maybe capacity stipulated for 100 or 150, you can't have more than 50 or 75 in there. We stipulate very carefully that no more than one family member should go in there to do the shopping. We're trying to get the lines so you know what is 6 feet back when you're in the cashier's line. We're asking people, don't use cash, use credit card. And more importantly, if you can get things delivered, home delivered and as such, especially if you're a senior, we don't want you to go out shopping at all. Although, as you know, a number of our grocery stores have said at least they'll have special shopping hours, 7 to 8 in the morning, for just those over 60, those who are the most vulnerable. I've spent a lot of time telling you that almost all the fatalities are related to people who are over 70 and over 80. But we have a tragic milestone in Connecticut. Probably the youngest person ever to die of COVID has died here in Connecticut. That baby was less than 7 weeks old. And it just is a reminder that nobody is safe with this virus. And for those young people who think maybe they're a little more invincible, think again. You're endangering yourself, you're endangering your family, and you're endangering everybody you come into contact with. We just got off a briefing with all the governors, and a little bit of common language. Real worry. Thanks for the CARE package, the $2.2 trillion package passed last week by Congress. They say it won't start rolling out till April 24th at the soonest. And April 24th, I just heard from a number of governors, means thousands of bankruptcies for small businesses between now and then. And governors are pleading to do anything they can to get that money out. And I know some of the money requires guidance, as they say, as they try and create what is the right package for paid family leave or sort of unemployment comp for the gig workers. Some of those are new programs, but a lot of these other programs, it's really important that they be able to accelerate that. And frankly, a lot of the states are really in a cash crunch right now. A lot of them have to go out for short-term borrowing. We're in a better position there. I might as well give you the good news as well as the bad news. And Connecticut is much stronger financially. And I feel good that thanks to Treasurer Wooden and Commissioner McCall, we have a strong cash position. I'm proud of the fact that we did not spend our rainy day fund. We've got $2.5 billion there. So we have enough cushion to help us weather the storm at least longer than most of our peers. And what that means in terms of hopefully a bridge until the federal programs come in. What we're able to do in terms of our bridge loan program, the Connecticut Bridge Loan Program, to help out our small businesses. You know, we talked yesterday about how others are stepping up, how the utilities are going to give companies a grace period, how the IT companies and the cable companies are giving a grace period, how as of yesterday, the banks, you saw the banks grouped in, and there's going to be a grace period of no foreclosures, grace period in terms of paying your mortgage, everything we got to do to give people a little more time going forward. And I hope there's somebody who might ask me about what we're going to do with insurance. Let me tell you what we're doing with insurance, the property casualty insurance and the health insurance. I'm really proud of these folks. They stepped up. I mean, this is a time of incredible stress, and they're offering a 60-day grace period, no payments necessary on your health insurance as well as your property and casualty. Stepped up first in the nation going forward. And I'm working closely with New York, and I think they're going to be right alongside of us doing this and hopefully setting an example. Look, we're in a healthcare crisis, and God bless those health insurance folks. Nobody's losing their health insurance because of this. If you have a COVID-related distress, you're not losing your health insurance. We're covering you for at least the next 2 months, thanks to the carriers. And then, as you know, the federal package and the loan guarantees cover all small business and individuals as well going forward. I'm really proud of what we've been able to do to ease the economic and financial pain. The healthcare anxiety is enough. We're doing everything we can to relieve the financial anxiety. And one last group I want to say thanks to is a group called 4CT. 4CT is made up of individuals who really care about our future, know the stress that people are under, have raised over $10 million in less than a week, $10 million. And we're working with our major not-for-profits to make sure that that money goes as a bridge before the federal money comes in, helps those that are most in distress. So I cannot be prouder of 4CT. Go to 4ct.org and do what you can to help. Because with everybody sticking together, this is how we get through this and are stronger for it. Thank you, everybody.
Governor, how soon could it be before our state needs to make use of mobile hospitals like these? And do you anticipate having to create any more of them across the state?
I anticipate we're going to need more of them across the strait. Josh Jabal and our FEMA team are scouting out other areas as we need. Look, right now, let's face it, Southern Connecticut is getting closer to capacity. And at some point, because we've got all of our hospitals working as one system, not individually, we're going to be able to offload some of their demand to facilities like this, opening up more space in Southern Connecticut for real ICU intensive situations. And frankly, in the next 4 weeks, it could be in reverse, where some of the folks from Northern Connecticut are going to find they have some excess capacity in Southern.
Yesterday we saw the numbers jump in Stamford and the day before that in Norwalk. Does the state logistics, are those dynamic to those numbers, or are you just sort of planning ahead with what you project?
I think our modeling has been pretty close, and working with the hospital people, telling us what to expect, where you see that curve going. I think the social distancing is making a little bit of a difference. It's probably too early to say, but you heard Dr. Carter say a week ago that he thought maybe New Haven and Hartford would be accelerating faster, and people are taking this seriously. So I want to be closer to Seattle than New York City in terms of results.
A question from John Craven, who is actually at home recovering from this, and wanted me to ask you, you've already stopped evictions for renters, but housing groups say that's only going to delay evictions, and landlords could still report late payments to credit bureaus. They want you to institute a rent freeze. Is that coming?
Right now, let's deal with what I've got. There are no evictions, and we've got forbearance on all your mortgage payments. You can stay in your home. Your business can stay where it is. You can be safe in terms of knowing that, at least for the next 2 to 3 months. As I told you, the federal government is stepping in and filling the gap for up to another year thereafter. So I think that's a good start, but we are working with the landlords very carefully to make sure that they treat people with respect during this time of need.
Governor, we see the beds, but do you have enough people to staff them? You have medics, are you going to call them?
Yeah.
Can you do that when you have facilities all over the state?
I can start, but maybe Dr. Troy or Josh would like to speak to that. We have now well over 3,000 folks who have come in out of retirement, come in with different health care skills, ready to step in. A lot of them will be able to help manage right here. You know, Josh will point out we got to check everybody's credentials. We got to see where they are in the licensure, get them up to speed. But I've been really impressed with the quality of the people volunteering.
Yeah, I just add, each of these surge hospitals that we're setting up, or these COVID step-down units, have to operate under the license of one of our existing hospitals. So in this case, we express great appreciation to Yale New Haven Health System for sponsoring this facility. They will be assigning a leader to essentially run it and establishing a staffing plan. And then, as the governor said, we're going to be working with them to supply staff where the hospital's existing staff is short. Obviously, they have to operate their existing facilities. They're surging in their own 4 walls already, so they have a lot of needs from a staffing perspective, and the state will step in to help supplement that. The state will also be providing the dining and the food capabilities, the dorms for healthcare workers who would prefer to stay here rather than go home, and a lot of other ancillary services.
Governor, which models are you using to make your decisions, such as opening this field house here? Which models are you using, and what are your views on the University of Washington model, talking about 1,000 deaths in Connecticut?
I haven't focused as much, Chris, on the exact model, because I know that whether we increase our capacity by 50% or 100%, every indication is we're going to need all that capacity. So what I'm doing is making sure everything I do, I expand capacity as fast as I can, fight for every ventilator I can get all the PPE we can, make sure we have more field hospitals like this, do everything I can to expand the capacity. We'll still need more based on every model that I've seen.
How is that battle going? How is the battle for PPE and the ventilators? The national stockpile has been depleted. The president said you're on your own.
It's not going that well. I mean, we're down there fighting every day. You know, Josh and his team, we got 40 people at DAS. All they do is source down every protective gear lead we can. They're coming from all over the world. We're scrambling at this stuff. And we got it on the tarmac. Then it's rerouted. We have it ready for delivery, and then it's put off for another week. And it's a bit of a mess out there, Christine. And you're playing with people's lives. These are life and death decisions. You know, that said, I can guarantee you we're leaving no stone unturned. If it's money in advance, we're making sure that we're able to do this. We're vetting this as best we can, but not going to deny ourselves the opportunity to get people the protective gear that they deserve.
Can you tell us about this 7-week-old? Did the 7-week-old get this from his or her parents, or what kind
You know
of
that, Josh?
details can you tell us on that?
The only details we know about the 7-week-old is that they came to the hospital unresponsive and passed away and were tested post-mortem and tested positive. That's really all we know at this point.
What town was that?
Hartford area?
It's in Hartford County.
Josh, any numbers about recoveries as far as people who've been released from the hospital? We hear a lot about people who've been admitted. How about those who recovered?
We don't have the recovery data yet, but we're working on that.
Are you seeing Connecticut's rate of hospitalization or rate of mortality the same as the rest of the country, or are there any patterns of difference here?
What we've seen in the data so far is pretty consistent with what we've seen in other parts of the country and around the world. It's a virus that is particularly harsh on the elderly. We've seen that in the data since the early days, both in terms of hospitalizations and mortality. Beyond that, you know, no real outliers from a Connecticut perspective at this point.
Governor, on the homeless, communication between the Department of Health and funeral homes, the potential directors that will be taking on these deceased bodies, the communication with them about how they proceed with the deceased from COVID-19, and any sort of communication from them on taking on a potential number of bodies that they may not regularly be used to taking on.
Yeah, I'm going to have to get back to you on that. I'm not familiar with those specifics.
Governor, with regard to the grocery stores, or any stores for that matter, have capacity, how can you fulfill that directive? Have you told the managers, store owners, you've got to essentially stand with a clicker by the doors?
I think people are doing really well. People are taking this thing seriously. Look, we've had the municipal police, we've had the state police, we've gone, we've checked, we looked at places where there are apparently going to be crowds, we worried about that, and we found that in almost all cases, people are taking these social dictates pretty seriously. And frankly, the customers are taking it seriously as well.
You go to a lot of the big box stores, though, and they're jammed with, you know, people two side by side going up and down aisles.
What you do is tell me where we ought to send people. We're going to get some folks there to look at those very same box stores. We're not going to let that happen.
Governor, back to the modeling. In other words, obviously you're preparing for the worst, but what assumptions are you operating under? In other words, what is the maximum number of hospital beds that you need? Obviously, you wouldn't be opening this up if you didn't need extra. So what are the assumptions that you're operating under?
As the governor said, we're operating on the assumption that we need more than we have now. We don't have a fixed number that we're targeting in total because the dynamics are very fluid. So we're looking at a lot of different models, as the governor mentioned. And as the governor has been saying for over a month now, essentially planning for worst case scenarios. So as the general said as well, we have a list of additional sites we're going to be looking to open up. And if we don't end up needing everything that we stand up, then we can all high five at the end of this. But right now we think we're going to need significantly more than we have right now.
Governor, I have a question on homeless. In New Haven, they're trying to put together a census for homeless people who were hospitalized and now are out, still need some care. Could they essentially come here? It's the same situation, isn't it, for any patient?
What I do know is we've negotiated with a number of hotels right now, and we're going to be able to take a lot of our homeless into those hotels. They're in a separate quarantine area. So I think that's probably our priority right now.
Well, New Haven said they need 300 beds for the rest of to empty all the shelters in New Haven. They need 300 beds, and they would like the state to actually cover that cost. Have you come to any agreement on that?
Our first priority is to make sure that anybody who's homeless and is tested positive or came into contact with people who are tested positive could be quarantined in a separate area. And those are the beds that we've contracted for right now, so that by the end of today or first thing tomorrow, they're all going to be a separate quarantined area.
Right, but a homeless person who goes in, has COVID, and then is released from the hospital, essentially the same as people here, to recover, they would just be part of that group, correct? I mean, they would be part of those patients. I mean, they're homeless, but that should make a difference.
Well, I think that probably makes good sense to me, Mary. Let me think about that. What we are trying to do is make sure any of these congested facilities, like I said, be it for the homeless, be it group homes, even, some of our correctional facilities, make sure we have enough capacity there so people can be separated out and quarantined as needed. And the homeless are in that category.
Okay, just so I understand that this facility is for people who have COVID, who are out of the hospital, but still need some care.
That's my understanding, yes.
Governor, could I ask you, are you able to give us an update on the nursing home shuffling going on at this point?
I think I can. I mean, we have a number of our nursing homes where people have tested positive. Most of these nursing homes, as you know, we were planning to close some nursing homes in our last budget. At this point, that means there's a lot of extra capacity there. There are separate wings where we can put people. There are empty nursing homes where we can put people. So a little like Mary's question for the elders, at least we can get them in a separate quarantine area. We can trace back and make sure everybody they were in contact with is separately quarantined as well. We have that capacity.
Is there negative airflow rooms at these nursing homes?
I believe there is, yes.
Governor, just want to clarify on this big announcement for insurance. A lot of people breathing a sigh of relief right now. Will these health insurance companies be broadcasting this and advertising this to their customers? Any clarification on what this announcement means?
Well, I'm broadcasting it, let's put it that way. And I hope, look, they are going to be very clear with each and every client that contacts them. They're going to, the client knows that what I've said, they're going to make sure that they are clear about what that is. And we have an insurance commissioner that people can always appeal to. But I'm not worried about that. I got to tell you, the health insurance guys, as well as the property and casualty, have stood up. They've done the right thing. And I just think that gives people a little peace of mind in a time where we could use a little peace of mind. Thank you, everybody.